Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. In today's episode, we'll be discussing the business of giving patients control of their health data. And be sure to follow the show on Twitter at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 16 years of health IT blog content at healthcareitdata.com. So, Colin, do you have access to your health data?
John, I am Canadian, therefore I do not have access to my own health data.
That should be easier. It's all one system.
Yeah, I know, and we have actually a patient identifier that's universal, right?
Yeah, exactly.
Yeah.
I guess the patient identifier doesn't solve all problems, like they say.
No, it just makes it more tantalizing because it's possible, right? But,
That is so interesting, though. Why don't they give you the data? It's just not a priority in the investment?
yeah, well, because the government just hasn't invested to make the systems available. We can get our lab tests now, and they are slowly doing this, but it's not like it's not like I can log onto the portal and it just instantly access everything from the payer side of the government that runs it.
Interesting.
I can only get bits and pieces, much like you can in the US, right? I have to go to the hospital that I went to go get my data. I have to go to the lab to get my data. Yeah, not a lot of fun.
Yeah, I mean, I don't have mine. A part of me has said, well, what would I even put there? Because I'm relatively healthy. The only incidents I've had are like all orthopedics. Like I consider him my primary doctor, my primary care doctor, because I would like to play sports and hurt myself.
Right.
And so, yeah, I mean, like I'm like, what would I put there? They're all incidents that don't really have an effect on the future. My hernia operation when I was 14, do I put that down? I don't have any allergies. I'm not on any medications. Like, what do I even put there? So that's why I'm like, yeah, it's just not worth it.
Well, actually, that leads me to my question for you, John. Like, so why do or patients need or want access, or for that matter, control of their health data?
Yeah, it's a really good question. And I think I should start with this premise. Patients should have access to all of their data. So like, I think we both agree on that, right? That like, hey, they own access to the data, they deserve access, and they should have the opportunity and the right to get that data. And we should make that available through these systems. So that I think is clear. And the government's gotten way behind that as well. I mean, that's the thrust of their efforts. And so I think, they should, right? And in some cases, it makes complete sense. I think of our good friend Grace Cordovano, who's an advocate for many cancer patients, and the work that she does to advocate for that patient requires access to the data so that she can advocate effectively for the patient. And that is the ideal way to get care, is to have either yourself or someone else as a patient advocate accessing the information to make sure it's accurate, to find out what the results are, to make sure it's being shared between it. I mean, this is, at least in today's healthcare system in the US, this is a valuable thing if you want the best care. And so patients, especially with chronic conditions, need and want access to that so that they can know that they're getting the care that they need and that they deserve, and that it's going to be the best care possible for them.
Yeah, no, I can't disagree with you. I think access, to me, there's two parts to this question. One is access, and I agree. I think everyone should have access, and it should be as easy as possible, as friction-free as possible. And yes, the government has done some things in both countries and countries around the world to enable that for patients, right? And I think that's a good thing. We're not there yet. There's lots of still hurdles and challenges, which we'll talk about in a second. But I think that is a good thing. I think the control side, though, is a bit interesting for me. As a patient, and like you, John, like relatively healthy, not a lot of chronic conditions, so knock on wood, I'm not in that sort of category. Do I want control of my health data? Like, do I want to get into, like this pharmaceutical company who wants to run a test, who needs my access to my data? Do I really want to be like pinged every single time that happens? And do I really, what happens if some specialist wants to look at something? Do I want to be able to authorize it and say, yes, they can, like every single time? I'm not sure. I want that, at least for me. So
Yeah.
I think the control aspect of it is interesting, because then if I control it, then am I responsible for maintaining it? Right? Like
Hmm.
if I had control of my data and I was actually the only one in control, does that absolve the healthcare organization of storing their own version, right? And so every time I go, I have to like give them access to my version. Does that mean I have to maintain it and go, well, I got to make sure the codes are correct? Do I have to do the terminology translation between what this person said and what that person said? Like that's where it gets really interesting for me in terms
Hmm.
of whether or why patients don't want it, actually want control.
Yeah, and that reminds me of, I think it was Greg Meyer who would often say this in various HITSM Twitter chats and whatnot. He'd be like, patients don't want to control their data. They want the organizations to share it where it's needed, when it's needed. And I think he's right that, like, for the most part, we want to control it because healthcare organizations aren't doing what we thought they were doing, which was sharing it where it was needed. And with the specialists, and having the specialist talk to the primary care doctor, and having the ED share with your primary care doctor or with the specialist what was happening, right? I think a lot of people thought that healthcare was doing that. And so then they bump into some condition and they realize, oh wait, you don't do that.
Right.
And so then they're like, well, then I guess I have to do it myself. And so, I think patients want to do it because the healthcare system isn't doing it. If the healthcare system was working effectively and sharing data where it needed to be shared, I don't think patients, I know I definitely wouldn't want access, wouldn't care about access to my data at all. But what I do care about is making sure that my data is to the right person at the right time. And sure, maybe as a control freak, I want access to the data just to verify and, do
Yeah.
those types of things. That makes sense, right? But my goal would be, it's kind of like my bank, right? Like, I don't want access to it necessarily to be able to share it with the next bank. I trust that the banks are going to reconcile it if I do an ACH transfer, and it's going to work effectively, right? But I do want access to just verify, oh yeah, it was done properly.
Yeah, I can totally see correcting information and making sure that what's inside is accurate. Also, there may be some problems that maybe I'm more incented to look for or look at if I had access to my data. But again, I go back to having access is the critical part, and maybe I even want to know who has access to my data. Like I want to see, oh, it's these doctors, these facilities, these organizations. Okay, cool. Like
That's a
I
whole
want
other
to.
can of worms.
Right. But but I want to see that. Do I want to control that though? I mean,
Mm.
maybe in certain instances, I don't want Google to have it because maybe I don't believe in the research they're doing. Okay, fine. I can kind of understand that. But let's be honest, that's not the major use case for health data for me as an individual. Most of the time, yes, as you put it, it's this other organization that I have had to go to see that needs access to my record in order to give me the care that I want. And so do I want to be in the middle all the time, filling out the consent forms and authorizing them to this record? And, the answer is no. I would have expected, as you said, that the healthcare system takes care of this, right?
Well, and I think that's the problem, is that everyone that's been in this situation realizes that it's not going to happen. Like, I think that's why so many people come to us, and it's just astounding how many companies come to us with, I've got a great idea. What if we aggregate all the patient's data and give them it all, and then they can give it to the provider that needs it? And like, I think we realize why that's needed is because we know that the health system is not going to solve this problem for us. There's just too many entities, there's too many formats, there's too many players, it's too distributed across companies and organizations and standards and et cetera, that I think it's clear we're not going to solve this, at least in the immediate future. And so then the question is, okay, if the health system is not going to solve it, well, then it is up to the patient to access their data, ensure that it's being shared properly and all that. And so, where do you see that? Like, okay, we all see that's a problem. We all see there's value in the right people having access to your health data, but what are the challenges for why this hasn't happened?
Oh, you just hit some of those in your statement just there, John. Like if you've ever tried to get your own data, forgetting about like giving it to someone else. I mean, just you yourself trying to get your own data. There are so many places you have to go to get your complete health record, right? There's the lab you went and saw that one time, right? There's all the tests that you've done at your local pharmacy who doesn't talk to the health system that you went to, right? There's the place you went for your broken leg, which may or may not be the same place that you get your primary care. So there are so many, first of all, there's so many different places, and then each of those places has their own system. So you getting the data and getting it into an electronic format, that's great, but then it's not the same format. Some may be in Fire, or CD, CDIAs.
So maybe
Maybe
a text message on Facebook with a doctor friend that
exactly, like there's so many different formats through no fault of the system. It just, you could say, well, shouldn't the healthcare system have been on a single standard format? The answer is, well, maybe, but what about your dentist, right? What about the
Mhm.
chiropractor? Like, how far do you go to get that longitudinal record? So I think that's the biggest challenge, is just the breadth of places you have to go. And then, yeah, the data format that these are in, they're not the same.
Yeah, this is my favorite story in regards to why getting access to all of your data, which, I mean, there's an interesting question. Do you need all of it? And I think the answer to that is yes, or nearly yes, right? For it to be really valuable to you. And so, my favorite story was a company that was literally paying doctors to give them the data for patients. Their business model, which, obviously it failed, but they would go to the doctor and they'll say, we'll pay you if you upload the patient's information here, or you transfer it here, or whatever. And guess what? Even with paying the doctor, they still couldn't get the doctors to give them the data. And you're like, wow, this problem is hard to solve.
Yeah, it's very challenging. And like I was saying, like, how far do you reach down? Like, what about Fitbit information? Like, that's health
Mhm.
data, right? Like, and
And
they're
that might
not
be the
governed.
easiest data to get, ironically.
Probably, but so that's one challenge. Then second of all, like, what's the challenge? Like, once you have it, right? Like, let's say you're able to get all of the data, which, is a magical thing. It's like a unicorn. I'm not really sure we're ever going to see that, but let's say you were able to do that. Now you have all this data. What are you going to do with it? Like, are you like, there's no service that I can subscribe to that says, oh, like, I'm going to subscribe to this early warning system that, should anything happen to my data, then it warns me. Like,
Mhm.
I'm not really sure, like, what do I do with that kind of stuff? Do I give it to an analysis company, like, that would tell me what my percentage of likelihood of getting cancer is? Maybe, but that's like a one-time thing and I don't need it again. Right? Like,
Ironically, that may be the way that this breaks out. It's less about the kind of institutional healthcare data that's in the EMR and the Fitbits of the world, which is a bad example because it's not that medically relevant. And so maybe it's the Alive Cords of the world and the Apple Watch and the Withings watch, those
right.
ones that are doing the ECG. And and then also they have my scale and also have my temperature, and now they have a sleep one, right? Like, if we get those combinations of sensors that aggregate, again, it's got to aggregate all the data across 5 or 6 sensors, possibly multiple companies, still a major problem, right? But once it does, could they do something of like what you described, which is proactively tell me how my health is doing and the risks that are associated with my health, so they actually work to keep me healthy as opposed to just treat my chief complaint? And so I think that's where it actually may be more interesting, is the consumer health data actually having an impact on my health more than it does aggregating the EMR data around a chief complaint that I already know about and has already been fixed. And so, to your point, like, what value is having all of that data when it's already been treated and not, I'm healed from it? Like, it's not as valuable for sure.
Right. Right. Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're discussing the business of giving patients control to their health data. So, John, let's talk a little bit about the business side of gathering all this data into one place. So we're going on the assumption that this is possible, and we're ignoring the fact that, is it really needed?
We
But
can get all the data.
we can get all the data. What are some of the business models that you've seen cross your desk about what people are trying to do once that has occurred?
Yeah, so there's 2 that I've seen most common. I'll throw one and then let you chime in. But the first one that I think is a real problem is, do I have to fill out that intake paperwork when I go to the doctor. If we could solve that, right? Like if some system could say, hey, if you fill out your information here, I'm never going to have to fill out that intake paperwork for a doctor again. Or if I do, it's 2 questions. What are you feeling today? And what's your problem? Like if I could stop listing my medications, my allergies, my family medical history, my everything else, if you could solve that, that would be an incredible situation. And every patient I know would go and fill that out and do it. Of course, the problem with this business model is some people have done this. In fact, it was almost a decade ago when I first heard about someone who did this in the No More Clipboard system, and he faxed the information to the doctor, which probably dates that story. But he faxed it to him, and then he gets there and he wanted to see what would happen. I mean, literally, it's his full record. It's more than they could ask on any sort of intake paperwork. And he shows up, and they hand him the clipboard, and he has to fill it all out. And so you look at that, and you're like, okay, it's great that you've aggregated all the data, but how do you bridge all the data being in one system or on a USB drive or in a portal or in whatever it is, right? On the blockchain, we'll throw that out there. Once it's there, how do you bridge that to the doctor so that the doctor gets all of that information in the workflow that they want to have? And that's the problem.
Yeah, it's an interesting problem, and you're right. I mean, that's definitely a model of if we could solve that, I think people would love it. But they don't. Related to that, John, I would say the other problem is, even if you, I think one of the problems that patients have is, I don't want to take that test again, or didn't I have this test already done by another facility a couple of weeks ago? Can't you just use that? So step one of that problem is, that system you're currently at probably doesn't have access to that record. So if you had access, would that prevent an extra test from happening? And my answer to that is, it probably won't. Having access to that prior test, in most cases, the facility you're at, the person you're seeing that's new, would probably want their own version of that test. Why? To validate and verify, because they trust their testing group or whatever they're going to do versus this other entity that may not be doing it the same way they want to have it done, or maybe weren't looking for the same things that they want to look for. So like the clipboard example, yes, I think it might be helpful in some cases to know and see the history of all the tests you've had done. But I think in a lot of cases, the doc you're seeing is just going to order another one. So you're not really saving anything. You're not really gaining anything by having that access to the data given to that new doctor, which I've heard of a couple of companies that were kind of banking on that ROI, right? Like to say, hey, like by having access to this record, you don't have to order that extra test. Therefore, it's a net savings to the organizations. My comment was, who's that money saving? Like, where's the savings coming from? Because it's just billed back to the patient anyway.
Well, and that's the problem, right? And this is a slightly jaded view, but I guess listeners are probably used to that from me. So, you look at that and you say, okay, here's my business model. Provider organizations, we're going to stop all of these redundant tests. Let me translate that for the provider organization. We're going to cut into your revenue and get rid of all these really profitable tests. Like that's sadly the pitch that it is there. It reminds me of, I think, Christina Farr. She tweeted out this amazing story, and I can't remember who it was. So maybe I'll put it in the show notes. But it was this guy. He said, "I thought if I solved patient problems, I would have an amazing company." He said, but it turns out healthcare doesn't work that way. And it's kind of exactly what you're describing, right? If healthcare was about the patient and about lowering costs, then this solution would just make sense. But there's a lot of people that unfortunately are profiting from the dysfunction of repeat tests. And so to your point, and you can usually come up with some sort of medical rationale for why you need to do it again. It was too long ago. I'm not sure I trust the data. Was the source right? Did you do it standing or did you do it sitting? Whatever, right? I mean, you can usually come up with something and do it again. And so that's why that's a problem. The other one that for me that stands out is data, selling the data. Right. People look at that and say, well, you're making billions on this data and selling it, or hundreds of millions. Why don't you pay me for the data? Because it's my data. And whenever I hear that, I think, yeah, that's true. They are making hundreds of millions and billions of dollars, many of these companies. But unfortunately, when you dig down deeper and you realize, wait, across millions of patients, you know, your record itself might be worth like $1.65. So you're like, hey, Colin, will you give me all your data for 46 cents? Because your data is worth that to me. You know, you're like, well, because as an individual record, it's not worth very much. But in aggregate, a million people across 46 cents, well, that's a lot of money. Right. And so I think that's the problem is we overestimate the value of our record. And there are some people probably that are worth $50 or $100 or even 500 or $1,000, right? But that changes the whole situation when the majority of people's are worth $1.32, right? So, you know, that's a great business model. I'm going to pay you $1.32 for your records. Yeah, not going to happen, right?
Well, and then it goes back to the problem you were stating before, John. Like, even if you found a company that was willing to, like a research organization, a pharmaceutical company, someone running a clinical trial, you're going to need the complete record, right? In order,
Yeah,
they're going
that's
to
true.
want the complete record. So, yes, they'll pay you, but they'll want everything about that patient. And then you're back to the problem of, do you have the complete record, or do you just have the fact that they are a 40-year-old living in this zip code without these chronic conditions or with these chronic conditions, and is not a smoker or is a smoker? Like, you have that basic information, but do you have all the latest tests, right? Do you have all of this kind of, who's it that they're seeing? Like, all that information potentially is information that is worth something to whoever is buying it. And then there's not, then forget about, like, what about the ethicalness
Sure.
of it, right? Like, you're going
There's
to
some
sell this
ethics
data
questions for
to a
sure.
pharmaceutical company that's looking to see how many people are on their competitor's drug, right? Or medication, right? Like, you know,
Yeah, there's a lot of interesting ethical questions there. And I think the overarching principle for me when I look at this is like, anytime I've had this discussion with people, we all like intuitively know that there's a problem. And we wish that the problem of the right data being to the right person at the right time was solved. But when you start to slice it up, you realize that in order to make a business out of this, you end up slicing out the population where it's like, oh, this would be a great solution for 1% of the population, right? Or for even 10% of the population. But everyone thinks, oh, it's a problem that everyone has. When in reality, no, it's like 1% of the population really would benefit from this or has value. And so finding a solution that solves for everyone, is just really hard to do.
I agree. I agree. So, John, where are some bright spots? Is there anyone, any organization, or any examples where you think this is actually being done well?
Yeah. So as I look at it, I think there are bright spots, I think we have made big strides. But here's the thing that we need, I think, to need to temper our understanding that help us understand what we've accomplished, which is, are we ever going to have a pure, perfect longitudinal health record of that patient? My opinion is we will never have that. I don't think that's possible. But I go back to, we don't have to have that to solve many of the problems we have in healthcare. Point solutions that share specific data and avoid redundant tests as we move into a value-based care world, right? Where redundant tests are a problem. And, like that can be really effective. And so, and even the notifications, right? I mean, I love what Direct Trust is doing and some of the other regulations coming out of ONC, talking about that if you went to the hospital, let's notify your primary care provider so they at least know that you were admitted to the hospital, you went to the ED, whatever it might be. Like, so some of those communications are some of the bright spots I see. Are they going to send the full patient record? No, like, but they don't need to provide value. And so I think there are these kind of point-to-point interoperability solutions and sharing of patient data that are powerful. And so I think that's, to me, is one of the most exciting things is, okay, let's put out of our head that we're going to have a perfect solution that shares every information that's needed. And let's focus on things that maybe are small slices, but they actually impact patient care.
Right. I mean, all we have to do is look at history and go, Microsoft tried to do a longitudinal record. Apple tried to do a longitudinal record. Google
Google
tried to do a
Health.
longitudinal record, and they got out of that business, right? And you'd think a company like that, you could argue, well, maybe they're so big, they got cumbersome, but they had some of the best scientists, some of the best people working on this problem, and even they realized, you know what, there's not a business model here. So I look at
Yep.
that history and kind of go, just kind of reiterating what we were talking about before. But I like where you went, because I agree. I think there's some bright spots that are very specific. I'm starting to see the rise of some very specific organizations targeted around clinical trials. And they're building these massive clinical trial databases for very specific types of
Hmm.
patients, not every patient, but for a very specific patient. I'm also seeing some organizations getting together. Like when we were at Vive, we met with Truveta, right? An amalgam of a bunch of healthcare organizations getting together and pooling their de-identified data. Why? Well, right now they're using it to kind of look at COVID-related and cases and seeing is hospitalizations going up and down, right, in our area, and is there anything we can do about that? Can we look at other public health data around that? And now, of course, they're looking at how can we monetize this de-identified data or make that available to other public health organizations so that they can tap into it. So it's working, right? These organizations have gotten together. They have massive amounts of records. They figured out a way to put that together in a standardized way, and they're making it available. So that to me is a bright spot where I don't know if they're figured out 100% how they're going to monetize it, but I like the fact that they actually got together and figured out how to put it in a common format.
Yeah, and I think we're seeing that with a number of organizations. You're right. That being able to access the data to evaluate it in aggregate, that is starting to happen on a scale that wasn't happening previously. I mean, I think of Clarify Health is doing a lot of that work, and they even partner with LexisNexis to access some of the consumer data along with the health data, which I think is, LexisNexis is an interesting partner for a lot of organizations that want to go beyond just some of the health data into, all sorts of types of data. So I think those are interesting. The other thing that, as I look at interoperability, like, okay, it's great point solutions and it's great, the aggregate data, but I also have hope with what's happening with APIs. Now we're seeing something happen is that once they've started opening the APIs, we realize how rudimentary they are and how much more we want. But once you just, have people desire something and realize, oh, this is possible, and I do want access to that, and I can be trusted with a two-way API that allows me to read and write to it. Like once you give, it's like putting a little piece of blood into the water for a shark, right? Once they start feeding, then they want more. And I think that we're at that point in APIs where we're like, hey, you gave me enough, now I want everything, and we're going to see some demand for that. And I think we'll see that evolution where these companies do open their APIs to a much broader access, and they start trusting organizations to be able to read and write to that API.
Well, let's hope. I mean, that's the hope, right? Like exactly what happened with GPS when they made it available to everyone. All of a sudden, you had all these applications now that use GPS, and it wasn't
Yeah,
until those APIs existed. So hopefully that'll be the
exactly.
same for our health data. Hey, that's another episode. So thanks to all of you who tuned in to Healthcare IT today. You can find out more details about our show by clicking on the programs page on healthcarenowradio.com. And of course, by sharing your voice and engaging with the community at healthcareittoday.com and on Twitter using the hashtag HITSM. I'm Colin Hung with my friend and health IT collaborator, John Lin. Thanks for listening. Have a great week.